This video will provide guidance on the application of NATROX O₂ for venous leg ulcers with compression. If the patient has mixed disease, it's up to the discretion of the prescriber whether or not compression will be used. For arterial ulcers, refer to the general application video in this series. To begin, the wound will need to be properly prepped. If you have not already done so, please view Prepping the Wound in this video series before proceeding. Starting on a clean surface, remove the NATROX O₂ ODS from the sterile packaging and place the wheel, shiny beige side up, directly onto the wound bed. If the wound is larger in diameter than 4 inches by 4 inches, a second NATROX O₂ kit could be ordered, or the location of the NATROX ODS wheel could be rotated on the wound with each dressing change. Secure the ODS tubing with a small piece of tape on the skin, paying special attention to the direction of the tubing. Position the tubing to run toward the waist. Next, apply an absorbent dressing over the ODS. The dressing choice is indicated by the amount of drainage and wound characteristics and is directed by the provider. Examples of absorptive dressings include foams, superabsorptives, alginates, or hydrofibers. There are many examples of absorptive dressings that can be used as long as they are placed over the ODS. As healing progresses, the superabsorptive may no longer be necessary, at which point an adhesive bordered semi-occlusive foam dressing is recommended. Change dressings as indicated in the IFU for the dressing or when leakage or strike-through of exudate or drainage is noticed. The goal is to eventually only need to change the dressing once every 7 days. The ODS will need to be replaced with each dressing change. Apply the compression wrap as ordered by the provider. Follow the manufacturer's instructions for specific compression wrap application instructions. Begin at the base of the toes with each layer. Take care to feed the tubing out between the wrap with the first layer to protect the skin from the tubing. An alternative to feeding the tubing out is to protect the skin with a gauze pad and run the tubing over top. The tubing will then exit the compression wrap near the knee. Slide a fully charged battery into the NATROX O₂ OG and confirm the green light is blinking. This indicates the device is working. The tubing should then be connected to the OG by twisting the luer lock clockwise. Be careful not to over-tighten. Secure any excess tubing with tape, a stockinette, or both. Place the NATROX OG in a place where the tubing won't get kinked. If using the holster, make sure the green light can be seen. For more information, please refer to the Using the Holster video.